Let me tell you just one example of what happens when people are not proactive, even though they see what's going on around them. As I've said before, I've been in healthcare more than 20 years. For at least 9 of those years, I've done some type of in-home visits, whether it's primary care, wounds care, some type of interaction with patients with chronic conditions in their homes. So when I'm in the patient's home, I usually take that opportunity to not only talk to the patient, but to talk to their children. When I say their children, I mean people who are my age or younger. One case that sticks out to me is a situation in which a patient had a lower leg amputation. He would consistently blame the fact that he had the amputation on something that the doctors messed up with the surgery. For several weeks in a row, I would have to reinforce to him that most likely his amputation was a result of his decades of not being active in his health care. Uncontrolled diabetes is the #1 reason that most people have amputations. And up until he was in his 60s, he had never been to the doctor for a preventative visit. He only went to the doctor when he was sick. So he didn't know if he was diabetic or not because he never had that preventative care. So I explained to him that people can have diabetes for decades and not know, and that 70% of amputations are caused by uncontrolled diabetes. Not just having diabetes. The diabetes has to be uncontrolled. So usually these are people where their A1C is 9% or greater. The smoking history and the uncontrolled diabetes history is what contributed to him having the amputation. So during these visits, the patient's son would be present, and I would mention to the son and ask him if he's going to the doctor to get his preventative exam. And he would say things like, I'm scared of what the result is going to be, even though he sees everything that's going on with his dad. There was still a fear and an avoidance tactic of not wanting to go to the doctor to see the results of his test. So after weeks and weeks, the son never made a visit to have an annual exam with his doctor, even though he had insurance. And what ended up happening is he had an episode of confusion, went to the hospital, and guess what? He found out that he was diabetic, and it was a life-threatening situation. So even though he had the example of what happened to his dad, the son never was proactive in his healthcare, and as a result almost lost his life. These are 2 different examples. One, what can happen when we're proactive with our healthcare. We can save not only our life, make our life better, but also the lives of our entire lineage. Or if we're in the spirit of avoidance, avoiding the truth about our health. On one hand, you can be a person like Anthony Anderson, be proactive in your health care, talk to it about your family. When your family sees how well you're doing with your health, you inspire them to make changes with their health. You're saving their lives, the lives of your parents and children. On the other hand, seeing what's going on to your family member, the complications that they've already had as a result of things like diabetes and uncontrolled hypertension, and still choosing to have an avoidance response to it, and in the meantime, almost losing your life because you're choosing not to look at the reality of your situation. So for everyone who has a family member who they've seen pass in the hospital, from personal experience of hearing hundreds of these cases in which people give me reasons that they don't want to go to the doctor, I would say in almost all of the cases, it's not a case of medical neglect. It's a case of the patient neglecting themselves. They went decades without going to the hospital. Even once they knew that they had diabetes or hypertension, they did not try to get their numbers under control. They did not change their diet. They did not take their medication. And so the reason that they pass in the hospital is because of ignoring their disease for decades. So that is how important it is for us to be proactive in our healthcare. It will literally save your life. This is a season of empowerment. This is a season for us to take our health into our hands. This is the reason that I'm doing manifestation videos along with healthcare videos, because in order to truly manifest the health that we need to have and we want to have to live healthy lives, we have to accept responsibility and accountability for our health. No one should die from stroke. No one should die from heart attack. No one should die from simple conditions. This is the season for all of us to be proactive in our healthcare, and when we are, we can see that how we can not only change our lives, but the lives of everyone around us.